I'm Dr. Sanjeev Singh. I'm a medical director of Amrita Institute of Medical Sciences and Research Center, Faridabad campus. Now, within the healthcare institutions, there was a lot of learning post-COVID. We also realized that when the patient comes in, he is always a query influenza or influenza-like illnesses. He needs to be segregated at emergency room so that the transmission of infection doesn't happen. That got created during pandemic time. So there were negative pressure areas in and around emergency was done. We were not triaging all the cases in emergency area, which got introduced big time during the COVID period. We also saw personal protective equipments like gowning, capping, masking, maintaining physical distancing and hand hygiene practices, which was complied to a large extent, and that helped in transmission of infections being less, and that was very, very helpful. So overall, Ignis Semmelweis in 1846 has talked about all of this. And in 2020, when COVID happened, we revisited it and improved quite a bit. And that was a very good learning for all healthcare institutions. So healthcare ecosystems has been changing. It has been an extremely dynamic process. We have seen it since 1946 when the Bohr Committee presented the public health policy. It was a three-tier system, primary, secondary and tertiary. At that point of time, that was most essential, and the primary and secondary care really got developed in the country, and because of them we have a fantastic rural-based healthcare system. What was lacking was an urban healthcare system where we see segregated into two. There are some standalone centers and then there are multi-speciality hospital. I think the learning comes again from many of the international centers. We have seen Johns Hopkins, we have seen Mayo, Stanford, Cleveland Clinic, where they are big centers, but they become a referral unit, and that is where they develop as a referral unit. So which is very different concept, and it aids easy referral to a very high-end quaternary care center. Now, if we come back to India, we see a similar setup getting established, which is slightly different from what NHS has, but very much similar to what US-based hospital has. We also are segregated into two. There are some good standalone dental centers, opthal centers, cardio, nephro centers. Those are good. The drawbacks are basically if there is a multidisciplinary requirement for a patient who has an uncontrolled diabetes, has to undergo a cataract, you have to look for a locum or a visiting consultant, and then there is no direct connect with the and having a patient to doctor relationship. So what has emerged in the country is a big time multi-speciality referral unit, and that has been extremely popular. So even if there are chains of hospital, each chain of hospital ensures that all multi-speciality wings are available. It is a patient-centric design where patient, when he comes in, while we see that the primary and secondary care is taken care of, for a tertiary care, when he comes in, he comes with multiple comorbidities, and that is where it is important that a team medicine practice and a multidisciplinary team practice happens, and that has led to a design and calling of all clinical services within one roof. It has been extremely helpful, it has been most cost effective, and it has been a patient-centric approach. So we have seen this in the West, we have seen this in this country, and there are very many successful stories. So we have run hospital in Kochi, which is our parent organization. That was a 1350 bed university teaching hospital with medical, super speciality, nursing college, pharmacy college and dental college. We bring the same learning to North India. In Delhi NCR, we have established a 133-acre university teaching hospital campus, which has a built-up area of 1 crore square feet. Within this facility, we have a super speciality hospital, which is largest in the country with the 38 lakh square feet of built-up area. We have divided the whole facility into two. One is a children's super speciality hospital. We have taken that vision of investing heavily on a children's hospital in a super speciality wing, which is lacking in the country. And the other part of the hospital is adult hospital, which also is divided into two, a corporate as well as free and economy hospital. So within this hospital, we also have 64 modular operation theatre, which is country's largest. We have 534 critical care digitally connected beds, which is country's largest. We have 300 bed of exclusive pediatric super speciality, which is again country's largest. We also have precision medicine and radiation oncology with 10 bunkers, which is again country's largest. We have invested quite a bit in our support services like lab medicines, which is 70,000 square feet of fully automated lab, which aids clinical decision making, and similarly a very high-end radiation imaging and nuclear medicine center. So overall, the intent was that it should be a patient-centric design, and all 81 subspecialty, which is again country's largest subspecialty services, all available in under one roof. So how we are different with respect to other organization is that it is a university teaching hospital. It has a medical college, it has a nursing college. We also have Allied Health Sciences College, where we will be running close to 28 to 30 Allied Health Sciences courses, and which would help build capacity and skill sets and aid clinical team within the hospital. But what is we are very proud of is a 7-story, 3 lakh square feet of research block, which is not to be seen in any of the hospital setup. So generally research blocks are standalone blocks which works in isolation. Here is where we are making that difference, and we are connecting the research block with the hospital. So any clinician has any question, he rushes into the research block and meets up with the basic scientists, clinical scientists, data scientists, and look for an answer. We are also very proud of another 4-story building, which is 1.5 lakh square feet of simulation, learning and development center. We will be seeing close to 89,000 medical graduates coming out from the country each year. We will be seeing close to 48,000 postgraduates coming out each year. Those are large numbers, but we also realize that the competency and skill sets may not be there. And that is where most of these doctors are taken abroad for skill sets training. We would be providing all of it at our hospital, where animal and human health training would be done, cadaver, haptic based and microvascular and high fidelity and low fidelity training would all be inculcated within this setup. So in totality, what we have tried to create is a very university teaching hospital setup, which will encompass learning and development, encompass research and development, innovation, and also delivering very high-end care to the patients who trust us and who reach us.